Hello everybody, my name is Dr. Coffler and I am with HRC Fertility in Oceanside, California. I would like to talk to you today about an issue that people find relevant during fertility treatments, and that's the concern regarding surplus embryos with IVF. Many feel uncomfortable about creating more embryos than the number of children than one is planning to have. So if you are a patient that needs IVF due to your medical condition and you feel this way, we got you covered. As many of you know, during IVF treatment, we prescribe the female partner hormonal meds with the purpose of stimulating their ovaries to produce multiple eggs. Those eggs are later fertilized with sperm, producing embryos that can be subsequently transferred to the woman's womb. Typically, we would transfer a single embryo in order to avoid the morbidity associated with multiple pregnancy. The reason that we attempt creating multiple embryos is to increase the likelihood of a successful outcome. If an embryo transfer is successful and there are extra frozen embryos available, the patient can return for her next child and have a frozen embryo transfer with no need for another whole IVF cycle. Same if the first transfer fails. If she has surplus embryos, she can have a frozen embryo transfer within a relatively short time period. If you are concerned regarding surplus embryos, we can offer you several options. First, we can decide that we will only fertilize an agreed upon number of your eggs and freeze the rest of your eggs unfertilized. This way, if you are successful, you can later decide to discard the frozen eggs without the moral dilemma. If it fails, we can thaw and fertilize your frozen eggs without the need for a whole IVF cycle. A second option is having what is known as mini IVF. This means using low-dose stim meds with the purpose of obtaining a small number of eggs and creating a lower number of embryos. A third and wonderful option is donating your surplus embryos for adoption by another patient. That patient can be someone that you know or be an anonymous patient depending on your preferences. We have a very active embryo adoption program and there is always demand for donated embryos. A fourth option is a compassionate transfer. This means that we will thaw and transfer your surplus embryos at a time when it's least likely for a pregnancy to occur. As I mentioned, if you are concerned about surplus embryos, we can offer you at least 4 different options for you to choose from. There are ethical and moral considerations for each alternative. There are also advantages and disadvantages, both financial and from the standpoint of success rate with each option, and I will discuss those with you at your consult. At this time, in line with California governor's orders and current recommendations by the American Society for Reproductive Medicine, we are holding off on starting new fertility treatment cycles. I want to emphasize that this hold-off is being reassessed on a continued basis. As soon as we can assure that it is safe for our patients, our staff, and providers to resume treatments, we will do it without any further delay. My Oceanside office and our HRC IVF centers have the capacity to accommodate any number of patients that will be interested moving forward. I encourage you to contact my office, schedule your phone consult now, and be ready to move on with your treatment as soon as this situation resolves. My office number is 760-758-2034, or you can call any of our HRC offices and request a phone consult with Dr. Coffler. Please stay tuned and check us out frequently for more helpful information, and don't miss my live webinar regarding fascinating fertility treatment options on April 14 at 6:30 p.m. Again, this was Dr. Coffler from HRC Fertility in Oceanside, California, and I wish you all a wonderful day. Thank you.